Hi, my name's Carrie Beard.
I'm Rihanna Pierce.
I'm Vanessa Grout.
I'm Daniel Lehman.
And I'm Christy Phillips.
And I'm Chelsea Miller. We're Group 4, and we decided to look into hospital-acquired infections. I made a chart showing the infections that we researched, including catheter-associated UTI, pneumonia, surgical site infections, and central line-associated blood infections. The chart that I created included the infection, the sign and symptoms, and the treatment.
My area of focus was patient outcomes. Researching these topics, I realized any patient is at risk for getting these infections, but easily preventable for the staff and the patients. One common thing about all hospital-acquired infections is once diagnosed, the hospital stay increases. With patient confidentiality, there are not many reports of patient outcomes after being infected or cured from the infections.
And I focused my research on hospital policy and protocol for hospital-acquired infections. In the healthcare setting, MRSA can cause severe problems such as bloodstream infections, pneumonia, and surgical site infections. If not treated quickly, they can develop into sepsis and later lead to death. So it's important to know about MRSA, CLABSIs, or central line-associated infections, CAUTIs, which are catheter-associated Foley infections, and C. diff, which is Clostridium difficile, as well as ventilator-associated hospital-acquired pneumonia.
I was partnered with Vanessa on the hospital-acquired infections, and she said it all.
And my area of focus was on preventative care, and some of the research that I found was that most of the evidence is showing that having a clean environment and hygiene for patients will lead to better health outcomes.
I was also on preventative care, and just learning ways to prevent hospital-acquired infections are very important to keep both the patients and the healthcare workers healthy. One thing that I found interesting through this project was the fact that our insurance companies don't actually pay for the hospital-acquired infections. It actually falls on the hospital.
I think that I found difficult was with the patient confidentiality, there wasn't many posts of their patient outcomes posted.
Some things that I found beneficial were the fact that I work at the hospital, so I was able to interview Heather Marquise, who is the infection control registered nurse at Piedmont Medical Center, so that was a pretty cool experience. And I was also able to see all of the protocol that's done in the hospital from working there and having that experience.
One of the most troubling parts of this was finding the policies on the hospital-acquired infections because a lot of it overlapped with the preventative care.
I found it beneficial for the future because it shows the importance of having a clean environment and keeping your patient also clean.
One thing I found difficult was just working around all of our schedules and trying to get everybody together at the same time.
Thank you.